Hello, my name is Desi Savage, and I'll be doing my final project for my computer course on telehealth and its relations to technology advancements in today's time. The early stages of telehealth and telemedicine can both be dated back to the 1970s. It was very expensive and limited. The use of the video conferencing technology was to connect local providers with remote specialists. So, to sum that up a bit, say, for instance, you had a sickness or illness that your local providers or local healthcare workers were not yet familiar with. They would get on the phone with specialists to try to come to an understanding on how to treat you and how to give you the care that you needed. The real-time communication method is still used today, but advances in communication technology have made it much more simple and way more affordable. Using this video conferencing equipment is almost as good as having the healthcare worker or the physician in the room with you. In 2020, the world went into a crisis, a pandemic, more sort of to speak. A pandemic, excuse me, sorry. Okay, so due to the outbreak of COVID-19, telehealth became very popular. The last week of March 2020, there was a 154% increase in telehealth visits. Just the last week of March of 2020 alone, 154% increase. I had to repeat that. It was compared to the same time period in 2019. During the pandemic, telehealth had multiple benefits. It expanded access to care, reduced disease exposure for staff and patients, preserve scarce supplies of personal protective equipment, and reduce patient demand on facilities. So to sum that up a bit as well, in 2020, there were a lot of people going in stores, buying up all the household cleaning products, masks, gloves, food, toilet tissue, so that for really, in my eyes, no reason. I know everyone had to be safe and keep themselves and their families safe, but I feel like we should have left some for hospitals and doctors' offices, because those are essential places that could not shut down. So those should have been the first people to get first dibs at anything that were left on the shelves. During and after the pandemic, telehealth policy changes may continue to support increased care access. In addition to our face-to-face video calling, we now have the ability to transfer medical information instantly. We now have machines that measure, track, and report a patient's vital signs and conditions from the comfort of their own homes. Okay. What is telehealth, you may ask? Telehealth is sometimes known as telemedicine. Telehealth is the technological and electronic use of information and communication to provide care to patients when they are not in the same place as the doctor and or physician. If the patient has a phone or device with internet access, they already have everything they need to get medical care through telehealth. During the pandemic, they were limiting the amount of contact and try to reduce the exposure of the virus. Everyone wanted to keep their families safe, their friends safe, and other people safe as well. So the healthcare providers would send you a link or give you a website to go on so you can do video calling instead of you coming into the office and risking yourself and putting others at risk. Virtual visits addressed healthcare conditions wherever the patients were, even from the comfort of their own home, as I stated before. It was less commuting for older patients, no commuting during bad weather. Virtual visits shorten wait times to see a provider and gives you access to better doctors who are further away. What is telehealth nursing? Telehealth nursing is originally what patients have come to know in the past as counseling over the phone. However, with today's technology, telehealth nursing is able to reach patients, monitor conditions, and interact with patients using computers, phones, and webcams. Telehealth nursing doesn't always require certification, but it may require a nurse to obtain licensure in order to practice in a few states. In a non federal setting, telehealth nurses must possess a registered nurse license that complies with federal as well as state regulations. Telehealth nursing is a thought excuse me. Telehealth nursing is thought of as the use of telemedicine and technology to conduct nursing and deliver care in a remote location. The U.S. healthcare field is constantly growing due to resources, reimbursement changes, and legalities. The role of telehealth nurses is expected to grow in the future. What's the difference between telemedicine and telehealth? So, as I stated before, telehealth refers broadly to electronic and telecommunication technologies and services used to provide care and services from a distance. Telemedicine is the practice of medicine using technology to deliver care from a distance. Telemedicine is different from telehealth in that it refers specifically to remote clinical services, whereas telehealth refers to remote non clinical services. Okay. You have a lot of organizations and a lot of offices in healthcare systems that support telehealth and telemedicine. Virtual care. Virtual care is more of apps that some patients can download to easily help the physician or their healthcare provider. Through virtual care, the healthcare provider can monitor the patient's vital signs, records the vital signs are recorded via Bluetooth or manual input. Patients manage their daily medications and set medication reminders through virtual care. Improve clinical care. Healthcare workers can review patient vitals and health data remotely. Workers and patients can message securely from the portal. So instead of you getting on a video call or an audio call, you can send someone in your healthcare provider's office a message through those virtual care apps, and they will message you back instantly. Patient to provider video call and audio calls are also provided, as I stated before. Automatic timers are set to record time spent on patient data and patient interaction through virtual care. Virtual care is an end-to-end, ready-to-use platform for telehealth. It brings care to the home with the ability to provide care and track vitals such as temperature, blood pressures, and etc. And that would sum up my project. Once again, I am a little under the weather. I try my best, but thank you so much.